Now, being that it's after the 8:30 news on a Thursday morning, it's time for some What's Up, Doc, where we spend some time with our friends and experts at Mercy Health. This morning, of course, is no exception. We're going to spend some time now with our new friend, Allison Lawhorn, who's a licensed social worker. We're going to talk a little bit about Mercy Health at Home Hospice. Allison, good morning.
Hello. Thanks for having me.
Glad to have you on the show. Tell us a little bit about you.
So I'm a licensed social worker. I graduated from Aurora University in December, so pretty fresh. I briefly lived in Arkansas, and now I'm at Mercy Health at Home. I've been here about 4 months.
I just want to say, both my parents graduated from, not Aurora University. They graduated from Aurora College. A great school out there. That gives you a bunch of points in our book already.
Oh, good.
Good. Yeah, otherwise, we hang up and the interview's over, and nobody wants that to happen.
No.
That's right, yep.
Tell me about your interest and what got you into the field that you're into.
So I guess I always knew I was going to help people. I didn't really know how I would accomplish that, and I just kind of landed in hospice, and I love it.
Was hospice your first job in social work?
It's my first real job.
Okay.
Before I had my master's degree, I worked with children with behavioral health issues, and it was great, but, kind of burnt out of that, and now we're here.
Outstanding. Well, what you do and the people like you who do what you do is such a special thing and requires such a special person to do it. Our family has had up close and personal encounters, I think 4 or 5 times at this point in my life, and I have marveled at how people who are involved in hospice conduct themselves and go about doing what they do so well every single day. Would you agree that it's not a job for everybody?
Yeah, I think that is true. The end of life is a really sacred time, and it's really an honor to be a part of that. So,
I'm sorry. How long have you been doing this? The hospice care here in town?
About 4 months.
4 months.
Oh, 4 months. Oh, okay.
Yeah.
Okay.
I'm new.
So Riles, you've had a lot of interaction with the hospice. Unfortunately, I just had my first kind of introduction to hospice, and one of the things I didn't understand what hospice was. I always thought that hospice meant we're done here. The time is almost up, and we're just making things very comfortable. But honestly, hospice can last a lot longer than just a couple weeks or months, right?
Absolutely, yeah. I think there is a common misconception that it's really final days, and it's not. For the Medicare definition of it, there has to be a terminal diagnosis of 6 months or less, and that's an average. Every person is different, so we've had people on hospice for years. It really is individual, but we're there to support, and however much time is left.
And do that so well. What's the difference, Allison? Because we see these words quite often. Hospice, and I'm not even sure on the pronunciation of the other one. Is it palliative care?
Yeah, the hospice is palliative care. Palliative care is just symptom management, pain management. But palliative can be in conjunction with treatment, and it's any serious illness. Hospice is in place of treatment. You choose hospice when you don't want to go through, chemotherapy, dialysis, things like that anymore, and you really just want to live out your last days in comfort and with that extra support.
And that was the case with my mother-in-law, who passed just about a year ago today, or a year ago over the course of the last week, and was given a diagnosis of terminal pancreatic cancer. And the options, would you like to undergo chemo? Would you like to do these things and all that? And after discussion, and there wasn't a lot of it, she thought about it and thought, no, I would just kind of like to be comfortable with the time that I have left.
Sure, yeah, those things can be really hard on the body too. So it's a choice, but I think hospice is a great choice.
I remember sitting down at the hospital table talking to the hospice director at the hospital, and obviously that is a whirlwind time emotionally, just mentally draining and everything like that. And I was wildly unprepared. I didn't know much about hospice. I didn't know anything. If somebody like me is going into their first hospice meeting, are there questions we should be loaded to ask, or are you guys just taking care of all of that?
So if someone is interested in hospice, we set up, we call it a presentation. So we'll come in and we'll give you all of the information that you need. Of course, ask questions. Please feel free to ask questions at any time, but really we'll kind of give you the rundown of what's included. We have our medical director, physicians that attend, nurses, social workers, CNAs, chaplains, and we'll kind of give you the rundown of what to expect. And if you do choose it, our staff is really great, too, about, educating people as they're moving forward with it. How do you use these meds? How do you handle this symptom? So it's really an education process, too.
Go ahead.
And how often, when somebody does set up the hospice at their home, how often are you guys coming over to visit?
It depends on the individual. We can come as often as every day or as little as once every 2 weeks. When someone does choose hospice, we'll kind of assess them. A nurse will come out and see what the need is. And, of course, that can change at any time, too. As the illness progresses, you might need more care. So it's really individual.
What are the levels of care within hospice? Or is that one of those things that there's no template for it, per se? It's individually measured out?
Medicare has 4 different levels of care. The most common is going to be the routine care, and that's in your home, in a loved one's home. Even if you're in a nursing facility, we can go into nursing homes as well. And that's really the most common. We also have what's called continuous care, and that's if there's like a crisis situation that really needs like advanced management. You can have a nurse or a CNA there for up to 24 hours in your home, in the nursing home, wherever you're at. And then if it can't be managed in the home, you can go to general inpatient, and that's going to be, moved into hospital, nursing facility to get that really higher level of care. Both of those are kind of a little bit more rare. We do try to, prevent that and keep you in your home and keep you where you're comfortable. And then the last one is respite care, and this is really great for caregivers. If you have a sick loved one living in your home, that's a full-time plus job to take care of them. If you have something you need to go do, you're sick, you have to go out of town, we can take the hospice patient and put them, in a nursing facility, and we'll continue doing the hospice care just in a different location. So that's a great option for the caregivers as well.
I would imagine at times when you come into a scenario, you find a caregiver who is really wiped out and exhausted at that point.
Absolutely. Yeah, that is quite common. And the social worker's job, too, is to kind of work with the caregivers as well as the patient and kind of find strategies to help alleviate that stress.
You've said the word comfort quite a bit. We've said the word comfort quite a bit during the hospice segment here, and that's one of the words that's always bandied about. Is there any, for lack of better terms, do you guys make people better too? I mean, is there physical therapy? Are we looking for any progression at all, or is it just comfort?
In certain circumstances, we can do an evaluation to see if there's, a need for that. But really with hospice, in order to continue to qualify and remain on hospice, they do look for that decline, or at least, staying the same level. Now, that's not to say, we expect you to get worse. It's improving quality of life, too. Maybe not quantity, but at least if you're emotionally feeling better and you're in less pain, that can kind of improve that quality of life.
Who pays for hospice care, and how is it paid for?
Hospice is a Medicare benefit, so Medicare fully covers all of your nurses visits, medications, equipment that you need. Also, Medicaid pays for it, private insurance. At Mercy, if you don't have insurance and you need hospice care, we do have like a charity fund that can be used too. But it's included in your Medicare.
Outstanding. For people who have questions, and I know that there are lots of them who do, because this was a learning experience for me each and every time. Allison, how do people reach out to you or reach out to Mercy Health at Home Hospice to get some questions answered?
Sure. We're Mercy Health at Home, and our office is 815-971-3550. And any member of our team would be glad to talk with anyone who's interested in learning more, has questions. Just give us a call.
Outstanding. Well, Allison, you do wonderful work, as do all of your coworkers. We appreciate what you do and how you do it and how you approach it every day. And we appreciate you taking time out of your day for us, too.
Well, thank you so much. I appreciate it. And it was a great experience.
Excellent. I'm glad to hear that. That's Allison Lawhorn. She is a licensed social worker with Mercy Health at Home Hospice.